And probably I will have to point out two major break points or breakthrough points in pediatric respiratory medicine. One will be the transformative emergence of precision medicine and biologic therapies, because treating patients with severe asthma, as we did many years ago, which was only controlling inflammation, probably was not the correct way. And I think that right now, to some extent, to particular patients who have severe disease, being able to treat that that specific to target that specific site of inflammation probably is has shown better improvements in their lung health. And I will say that the second breakthrough is our understanding that most of respiratory diseases come or will develop in an early stage, and that if we want to prevent or really prevent the evolution of these conditions, we need to treat or prevent early, even in some diseases from pregnancy. Best things of Inspired. First, that is that only dedicated meeting in pediatrics. But I think that the second thing is that we have this long-standing relationship between high-income countries and low-middle-income countries. And what is very nice of this meeting is that we understood that respiratory diseases in children are universal. They affect every single children in high income countries, in low income countries. But treatment, assessment, I don't know, practices are different between all these different countries, because you have, if you live in a low middle income country, you have to organize and see what you can do and what you cannot do. And if you live in high income countries, you need to know that there are underprivileged patients that live in those areas that will encounter similar problems of what we that live in low middle income countries found in our patients. So I think that learning from each other about how can we work out in this kind of resource limiting setting certainly improves only the health of the children who are suffering from respiratory diseases. I think that again, what makes Inspired unique is that is the only meeting dedicated to pediatric pulmonology, and also it helps in many ways because we have sessions that are dedicated to translational medicine. So we have like new stuff coming, new ways of thinking, new ways of treating these conditions. But on the other hand, we have very important professors and clinicians trying to summarize what is the better management, updated management of many of these respiratory diseases to both high income, middle income, and low income countries. So I think that Inspire brings us an opportunity of being a very good meeting, but also keeping it as a simple meeting where I can go and speak with any of these professors, clinicians, researchers, and discuss on ways that we can actually help our countries in bringing, I don't know, changing policies, improving ways of diagnosing diseases, or maybe just having opportunities for mentorship or international collaboration in research, which I think the only patients that will improve will be our patients. Yeah, so that is a very difficult question because I mean I have to give my disclaimer. So I was in charge of the scientific program of Inspired, and it was very hard for me to choose which sessions will compete with each other and trying to see how can I make, let's say, those people who are interested in asthma not competing with other sessions that they might also be interested in. And it was very hard because I will say any session that you will go, I can assure you, you are going to come out of the session very happy that you have learned, that you inspired yourself to be a better clinician, and that you have new ideas to treat your patients. Now, of course, we have the highlights, which are going to be on the inaugural lectures. We have three amazing keynote lectures about global health and pollution and vaccine hesitancy. So I think those are very important topics. We have the plenary sessions, which are very well attended, and I mean those are very nice. I mean very important, up to date topics given by very high recognized professors. And then we have the symposiums, which are also very nice. And we have the clinical cases, which is fantastic from a learning perspective because you can see all the discussion that goes around a difficult case. And we have the oral presentations, which I will definitely invite everyone to go because those are the outcomes of research. So, I mean, I cannot point out one single session. So, I think we understood that many complex respiratory diseases involve many different specialties. And we have, I think that we learned that from taking care, for example, from CF patients, but also with tuberculosis patients, where nutrition, radiology, allergy, gastroenterology, immunology, I mean, I think it depends on the condition. Definitely, if you have a multidisciplinary approach, you will definitely have improvement or is improvement on their condition. Now, on the other hand, I think that the other part that is very important is international collaboration because, as we mentioned before, some of us live in countries where we don't have access to all different either diagnostic tools or maybe treatments. And if we have international collaboration, then we can just take advantage of discussing this with different people. One example is, for example, Inspired. So for us, we had many different difficult cases, and because we have the access to different people that we have known through the years by coming to Inspired, we can actually email them knowing that they are experts in this topic, and we can say, look, I have this patient with this condition. I know you have published a lot on this. What can you tell me? What can I do in my resource area? And I think that you will be amazed about the results that you probably can get from this collaboration.